to respond? How will you ensure that residents have access to essential health care, community services, and resources? And what strategies will you use to secure funding and resources for local health care initiatives to improve the overall quality of life in Cochise County?
So there are programs currently available for rural hospitals. There's supplemental funding that comes from the state and both the federal government. Most of the health care in this county is subsidized by the federal government. I mean, it's through Medicare, Medicaid, and all the various social services that are provided. The state administers some of those through what is basically the Access program, which is our Medicaid program in Arizona. The county is there to provide additional resources where needed. If there's a crisis that happens, an outbreak of something or some other catastrophe, we can divert resources to deal with that. But most of that money kind of filters through, and it's regulated and directed by the federal and state government the way it's spent. And there is not a lot of flexibility on the county government to do that. Again, it's only some of the reactionary things. The other things I think we can do is we can reduce some of the tax burden. If we wanted to set up a special district for hospitals, that's an opportunity. So we already have, for some hospitals, we have a hospital district here. The voters would then have the decision on their side whether or not they want to increase funding by increasing the hospital district tax. And that would be up to them. But I don't think it's too much of the county supervisor's job to get into the healthcare business. We have already way too many fingers in that pie.
Nancy, you have 60 seconds.
I'd support efforts to create an integrated local health ecosystem to enhance medical and behavioral health for soldiers, veterans, and members of the community. And I'd foster partnerships with local health agencies, veterans organizations, and community service providers to create a network of support that addresses both medical and behavioral health issues. I'd advocate for funding and resources to expand mental health services, substance abuse programs, and medical care specifically tailored for soldiers and veterans. I'd integrate care models, and I would support the development, of integrated care models that combine physical and mental health services, allowing for holistic treatments and alternative medicines. And I believe that with community engagement, we can achieve these things by involving community stakeholders for funding.
Joy, you have 60 seconds.
Well, healthcare is one of the biggest needs in Arizona. Arizona ranks 49th in the nation for access to adult mental health care. And Cochise County has identified that that's one of the biggest needs of this county, and substance abuse treatment. We do have a psych ward at Canyon Vista, and that's about it. Everyone else has to be shipped to Tucson, or you find your own way of doing it, is self-funded, and that kind of thing. We need those things. I don't know how to get it all to happen, but I intend to find out. And I know that Barbara Lang, our Health and Social Services Director, is doing the same. She's trying to build a workforce here, and we need to make this a place where doctors want to stay. Doctors don't want to stay here. They come and they leave, and I don't like that. But I don't know. We need to be attractive to younger people, younger families. We need more places where young people like to hang out. Things for young families. I'm talking about 30s, 40s.
Jacob, you have 60 seconds.
Healthcare is an issue that we're all faced with at least some point in our life. By statute, the Board of Supervisors is supposed to maintain a county hospital. But we can do that through partnerships. We can do that through the hospital districts. We can do that through collaborative efforts with healthcare providers that want to come in here that are either tied to TMC like we have now, or Canyon Vista, or Chiricahua, and we can have those partnerships so that it does not rest entirely on the county itself. You know, the local pharmacy here and in Wilcox recently closed down because of federal mandates with the healthcare system. We have no control over that, but what we can do is we can make sure that we are advocating with our partners to make sure that those facilities stay open. The sheriff's office has a mandate. Well, I don't know if it's a mandate, but they have taken and gone out and gotten grants for a mental health response team so that they can go out and deal with the
Question 9.